United States, the vast majority of clinical trials on medications and vaccines have been conducted without pregnant women in them. That is by design. It's an easier process to get them approved if you don't include pregnant women. So most of the medications, the overwhelming majority of medications that we use in pregnancy, were not initially trialed in a pregnant cohort. So that's just part of the world that we live in. The same thing happens for this vaccine. So we've had 73,000 between the two vaccine studies, folks who were studied. None of them were intentionally pregnant. There were some folks who conceived during those studies. We have no adverse reports from that, but they are still being investigated, of course. Those of us who are pregnant and getting the vaccine now have the option of registering with the V-Safe program so that our pregnancy data can be recorded if we so choose. We've actually had physicians and nurses at different hospitals offering up their serum, their breast milk, their amniotic fluid, saying if you have any need for any of this, please use it for testing. We want to contribute to science. Nothing that we have heard so far has been concerning. The Moderna Corporation did have lab mice who were pregnant and went through trial with the medication, and there was no adverse event reported in a December 4th report out to the FDA. So from that DART study, there was no evidence of any harm to the fetus with the dose of the Moderna vaccine. So when you don't have primary evidence, you look to people who are scientific experts in the field and say, what are they saying about this? So our primary societies that speak to the needs of pregnant women are the American College of OBGYN. ACOG has issued several statements since the vaccines were approved via EUA, saying that pregnant women should absolutely have full access to the vaccine and that pregnant healthcare workers should not require any type of note from their provider to approve them to be able to get the vaccine, that they should be able to walk into that line like anybody else and get that vaccine. SMFM seriously recommends full access for women who are pregnant or lactating or considering pregnancy and use language of strongly endorsing open access. The CDC similarly says women should have access if they are pregnant or breastfeeding. All of these organizations acknowledge that pregnant women were not included in the study and that every woman has a personal decision to make and should weigh risks versus benefits, including how prevalent the disease is in your population and how likely you are to be sick if you get the infection. What we know about pregnant women right now with COVID infections is that we are a higher risk cohort when you are pregnant compared to a non-pregnant reproductive age cohort. We have, of course, very sadly had many pregnant women admitted to our inpatient service, including women in the ICU and requiring mechanical ventilation. So we know that we are living in an endemic time here and that pregnant women are particularly vulnerable. So I lift that up to you as you make your own decisions. Finally, around the issue of breastfeeding, the Academy of Breastfeeding Medicine just recently issued statements strongly encouraging breastfeeding lactating women to encourage or to consider vaccination rather. So that is another kind of national society that has spoken out in support of lactating women having access to the vaccine.